in the study guide, if you look at the slides of the study guide or the study guide that's in your MBLEx folder, let me just open that so you know what it looks like. Okay, so here's our MBLEx folder. And if you organize things by name, you'll see FSMTB, e-study guide, pathology contraindications, kinesiology, anatomy, and physiology, right? And you can open it. And it looks like this, and then you just have to zoom in to make it clear. So if you look at it, there's anatomy, kinesiology, patho, benefits, client assessment, ethics, boundaries, right? And then it's organized by systems. So circulatory system, lymphatic system, muscular system, respiratory, etc. Yeah. So what we're going to cover today are the first like half of the circulatory system, right? The first 4 or 5 bullet points, and you're going to have to do the other 4 or 5 on your own. So we're going to cover the top 4 or 5, and you're going to have to do the rest on your own. And I'll prepare stuff for you for that. I want to remind you of the stuff you do not have to know. You do not have to know the minor blood vessels. So there's lots of them. They are the blood vessels that supply the heart, the smaller structures of the heart, like the individual blood vessels that feed the muscles of the heart. You're not going to have to know the names of the blood vessels and the capillaries that go certain places in the brain or the shoulder or the eye. All the types of white blood cells, basophils, eosinophils, T cells, killer cells. You don't have to know those. The function of specific white blood cells like eosinophils and basophils, you don't have to know those. So you don't have to know that they exist. You don't have to know the function. Identify the cascade of chemical reactions that allow blood to clot. So you don't have to know anything about clotting factor or anything else about clotting. You will have to know that, for example, that calcium plays a role in clotting, but calcium also plays a role in muscle contraction, nerve conductivity, and bone density. That's why something like calcium is important, because it's important to multiple systems, multiple body systems, multiple organ systems. Here's an example of a couple questions from the MBLEx that they give you, that the FSMTB gives you. Remember, the FSMTB is the one that makes and administers the MBLEx. The mineral in the body that is essential for the structure of bones, muscle contractions, and blood coagulation. Bones, muscle contraction, blood coagulation is calcium, potassium, sodium, or magnesium. If you have a reason you pick one, the answer is calcium. If there's a reason you picked a different ion, please unmute yourself and let me know. Or a different mineral, please unmute yourself now and let me know. So I would think maybe it's sodium, because sodium is so important in muscle contraction, and calcium is like second to that. But the question asks basically, what do all these systems have in common? Bones, muscles, blood. What do they have? Which one do they have in common? And the answer is calcium. The sodium is not that important for blood coagulation or for bones. It's only really important for muscles and for nerves. Okay, next one. Blood circulating to the lungs from the heart to the lungs from the heart would pass through which of the following structures? The pulmonary artery, the left ventricle, the ascending aorta, or the left atrium? And the answer is the pulmonary artery. Yeah. Say again. And these will be clear today. We're going to go over these structures today. Okay. So what you need to know, what you're going to have to study on your own, what you don't need to know, this is all going to be in today's recording. Am I recording? Let me make sure I'm recording. Yes, I am recording. Okay, great. If you go to your MBLEx folder on the Google Drive, if you click on body systems, today's presentation is in that folder, cardiovascular circulatory. So MBLEx Drive, body systems, there it is right here. Not all of these are fleshed out yet. Organization is tough. It's tough. Okay, so when you see this symbol on my slides, it means that the study points are from the FSMTB. That's just to reassure you that this is like from the source that administers the exam. This is under the anatomy and physiology section of the exam by the FSMTB, and it's the circulatory system we're dealing today. When you see descriptions like system structure and system function, it's important. The reason is because the structure refers to anatomy and the function refers to the physiology. So you know right away what it is that you're going to have to learn today or be responsible for. Of the study points, one of them, right? Remember your study points for the circulatory system. We're going to go through 4 or 5 today. Of the study points, the first one is understand the various ways massage or body work might affect circulation. So broadly speaking, the way that massage affects circulation is that it increases systemic circulation. Systemic and local, those are terms that you want to know. Systemic means throughout the whole body or body-wide or general. And local means in the area where you're working, the area where you're applying pressure or applying the body work technique. It increases systemic circulation. Now, this happens as a result of a half an hour, 45-minute, hour-long, whatever, massage, and you're working on a pretty wide area of the body, like the whole back surface, or half of the back surface, half of the front surface, something like that. And in the process of working on a wide surface, you create some inflammation, which is good, and you push the circulation, which is good, and that has an effect on the rest of the body. It temporarily increases circulation. Increases systemic circulation. Almost all the techniques, all the hand techniques, they cause temporary or mechanical ischemia. Isch means to suppress or to stop or to slow down. And emia means blood. So the hand techniques temporarily cause ischemia. Let's take like just pressure, direct pressure, right? What we call in shiatsu finger pressure, right? So just take finger pressure down on a tight wrist flexor muscle. It should make sense to you that pressing on that area occludes or temporarily stops or slows down the blood circulation where you're pressing. That's called ischemia. So ischemia is to suppress the blood or slowing down or lack of blood flow. Hyperemia happens after ischemia. So you press and that causes ischemia. You let go, the blood flow opens, the circulation opens, and as a result, there's hyperemia. A large amount of blood floods in. Just like if you stepped on a garden hose, the water slows down, and then if you take your foot off, the water comes through with greater force, greater volume than if it had been unoccluded, allowed to flow normally. Let me know if that doesn't make sense to you, that when you apply a hand technique, the majority of hand techniques, whether it's petrissage or effleurage or Swedish gymnastics or whatever, the vast majority of the hand techniques first cause ischemia, and after that, they cause hyperemia. They first cause occlusion or suppression of blood, and then they cause a large amount of blood. And system-wide, that results in an increase in circulation temporarily. So if they ask you, how does massage affect circulation? What would you say, Khalees?
Excuse me, I would say it increased the circulation.
Great. And if they say, what is the mechanical? Mechanical means the first effect while you're pressing. We'll go over that again. If they say, what's the mechanical effect of X technique, petrissage, what would you say? While you're pressing, the first effect.
It slows down
the ischemia.
I'm sorry, one more time.
Is it still on me or is it somebody else?
You, Khalees, please. When
Is
you
it
press
mechanical ischemia?
ischemia, yes, very good.
Okay.
Ischemia, yeah. And what does isk mean? Isk?
Suppressed
To suppress, and emia,
is the blood flow.
yes, thank you. Okay, so moving on to the second study point. You're going to have to understand the different blood vessels, like arteries and capillaries, and the functions of these blood vessels. So they're giving you like a broad and not a very well coordinated statement, right? They're not being specific enough. I want you to remember that the flow of blood goes from the artery, which begins with the aorta, and it goes into the veins, which ends with the vena cava. And we're going to look at those structures, the vena cava and the aorta. But if you can remember, please mute yourselves and repeat after me. If you can remember and practice and remember aorta to artery, then the blood goes from the artery to the arteriole, and then into the capillary, the venule, then to the vein, then the vena cava. This is a great mnemonic, or not a mnemonic, a great thing for you to memorize. Aorta, artery, arteriole, capillary, venule, vein, vena cava. One more time. Aorta, artery, arteriole, capillary, venule, vein, vena cava. That's definitely something that I would ask that you practice on a regular basis, like daily. So we'll practice that in our class. Actually, let me put this up here in the basics. And let's learn, that's the order of the blood flow. So let's learn a little bit more about these. So the arteries, the aorta is the largest artery in the body. Arteries carry blood away from the heart, artery, away, letter A. And the veins carry blood towards the heart. With the exception of the pulmonary blood vessels, so that's the vessels are arteries and veins. With the exception of the vessels that go to the lungs, the pulma, arteries carry oxygenated blood to the whole body, and veins carry deoxygenated blood. With the lungs, it's the other way around. The arteries carry deoxygenated blood away from the heart to the lungs, and the blood picks up oxygen, and the pulmonary veins carry oxygenated blood from the lungs back into the heart. The veins carry oxygenated blood to the heart from the lungs. So with the lungs, it's reversed. Arteries carry oxygenated blood throughout the body. Veins carry deoxygenated blood from the body back to the heart. Arteries have thicker walls and they have muscular tissue that contracts. That's part of why you can feel a pulse at this artery down here. What's the name of this bone? This is the radius. So this is the radial artery. Up here you have the jugular artery. You have the inguinal artery next to the hip flexors. And then you have the artery of the dorsal pedis. I forget what it's called, but ped means foot and dorsal means dorsum of the foot, on the foot. I forget what, actually, let me not confuse your artery. Dorsalis pedis. Yeah, let's see, what is this artery commonly called? The dorsalis pedis artery, dorsalis pedis. So dorsalis, from dorsal, back of the foot, pedis, ped meaning foot. Oh, my dog wants to go play with the other dog. All right. Veins have thinner walls. Veins have thinner walls and use valves to keep blood flowing. So they have to pass through valves in the veins in order for the blood to keep moving. The veins open and the valves open and close. And the valves also have a directionality to them. So they're kind of like funnels, and these funnels encourage the blood to move. Veins are blood vessels. located throughout your body that collect oxygen for blood and return it to your heart. That's the same as saying veins carry deoxygenated blood. Arteries, also vessels. Arteries are blood vessels that play a critical part of your cardiovascular system. They are the blood vessels that distribute oxygen-rich blood to your entire body. I'm going to take this out. Arteries are blood vessels that distribute oxygen-rich blood to your entire body. Okay, and that covers that study point. You guys will get used to this format. All right, so I won't have to keep telling you. You'll just have it in your mind that this is another study point that we're doing now, right? So this study point was understanding the different blood vessels, such as arteries and capillaries, and the functions of the blood vessels. The arteries carry oxygenated blood. The veins carry deoxygenated blood. The arteries are thicker and have muscles. The veins are thinner and have valves. The order of the blood flow is aorta, artery, arterial, capillary, venule, vein, and vena cava. Every time I say something that I've asked you to repeat before, I hope you remember to repeat it along with me, even if you're flubbing it and getting it wrong. So let's get into the flow of blood out of the heart toward the lung and into the body and back. There's 2 slides for this. So the first is just stating the learning objective or the study point, and that's to comprehend what occurs in the various larger structures of the heart, such as the valves and the different heart chambers, right? So what we're going to look at is the heart and the larger structures. And here's a small graphic of the heart and the heart and the lungs and the larger structures. And on the next page are the larger pictures. I may need to enlarge this for you guys. If I do, of course, it's no problem. But I want you guys to go through this every day. I want you guys to go through this blood flow on the right and the left side of the heart every day, because it's summarized very nicely. In fact, I think I put it in your MBLEx daily. Yeah, here it is. So you can when you look at this, you can enlarge it, you can blow it up, and that'll make it crystal clear. Okay, so we have, first thing you do is to get oriented, right? You always get oriented. Are we looking at the heart from the front or the back? Well, it says right here, look for whatever they give you. R is right. And R is right, is that right? Yeah, R is right. And then where's L's? They don't have L's. I took a L. They don't have L's labeled over here. They have it labeled on this other one. Okay, so you have right and left. Okay, if this is the right, my right hand is over here, my left hand is over here. This is literally how my process, how I do it every time. So I must be looking at it from the front. This is right, this is left, this is right, this is left. Okay, I got it now. This is the front of the heart. I know that S is superior and I is inferior. This is the top, this is the bottom. All right, so now I know that this is the top of the heart, this is the bottom of the heart. So on the right side, it goes from the SCV, ICV, that's superior vena cava, inferior vena cava, superior vena cava, inferior vena cava. I'm paranoid, so I'm going to make sure I'm recording, still recording. Superior vena cava, inferior vena cava, into the right atrium. So superior vena cava, that's the body's biggest vein. Inferior vena cava is also the body's biggest vein. There's 2 branches, the superior and the inferior. Guess why there are 2 branches, a superior and inferior? Emmy.
One's pumping out and one's pumping in.
That is an excellent guess, however, not accurate.
Okay, I don't know that.
They're both pumping into the heart, right? They're both pumping into the heart. So can you see me?
Yes.
Okay, so my heart is here, right?
Mm-hmm.
And above my heart is a portion of the body, and below my heart is a portion of the body.
Yeah.
So now, why is there superior and inferior vena cava?
For the upper half and the lower half.
That's right. The superior brings in blood from the, humor me please.
The top half of the body.
Yes, thank you.
And
And,
yeah, to the superior and inferior part.
and
of
the
body.
inferior brings in blood from the
Lower part of the body.
inferior portion. Correct, correct. You're not off the hook yet, Emmy. Atrium. Atrium is shaped like letter A, like a ceiling, like a roof. So the atrium is on top. Superior vena cava, inferior vena cava into the right atrium. Through the tricuspid valve, we'll look at the valves again. into the right ventricle, from the atrium to the ventricle, from the atrium, go like this with your hands. I can't see you, nobody can see you. Go like this with your hands, the right atrium into the ventricle. So
Into
the
the
atrium is on top, the
Yeah.
ventricle, the valley is on bottom. Atrium
Okay.
on top, ventricle on the bottom. Okay, you can, so which one is on top? The atrium or the ventricle?
Atrium, the
And which one
atrium
is
and
on,
the ventricle.
and which one is on top, on bottom?
Ventricle.
The ventricle, good. What's the name of the valve between them?
Atrium and ventricle.
Right here on the screen.
Tricuspid.
Tricuspid valve. That's right.
Okay.
That's
Yeah.
right.
Okay.
It's blue. Do you think this is oxygenated or deoxygenated?
Deoxygenated.
Does it make sense to you that deoxygenated blood would be coming from the top and bottom of the body into the heart?
Yes,
Why?
because it has to go through the heart to get oxygenated.
Yeah, it has to go through the heart to get oxygenated by the lungs. And also, Emmy, because once it's nourished the tissues in the top and the bottom of the body's done with it.
Uh-huh.
It's got to be recycled, reoxygenated. It has to cycle through the circulation to be reoxygenated. Okay, you can mute yourself. Thank you very much. Then after it's in the right ventricle, it has to go through the pulmonary, pulma means lung, pulma means lung. It has to go through the pulmonary artery away from the heart to the lungs. After it's in the right ventricle, it goes through the pulmonary artery away from the heart, artery away, and into the lungs. Deoxygenated blood goes to the lungs, it picks up oxygen, and it is returned through the veins, the pulmonary veins, into the left chamber of the heart. So the right side carries, just say to yourself, stay muted, but the right side carries what? Deoxygenated or oxygenated blood? Deoxygenated blood. The left side carries what? Oxygenated or deoxygenated blood? Oxygenated blood. They may ask you something like that, right? Which one carries deoxygenated? Which one receives oxygenated blood, or which one pumps out oxygenated blood to the body? So one more time for the right side, and then we'll move on to the left. Deoxygenated blood comes in through the superior vena cava and the inferior vena cava. They both feed into the right atrium, which is on the top chamber on the right side of the heart, right deoxygenated top side atrium. From the atrium, the deoxygenated blood goes into the right ventricle. To get to the right ventricle from the atrium, to get there, it has to go through a valve. The name of that valve is the tricuspid valve. Tricuspid valve. Once it's in the right ventricle, it gets pumped out into the pulmonary artery. To get from the ventricle to the artery, it goes through the pulmonary valve. The valve is named for the pulmonary artery. It goes through the pulmonary artery and it goes out into the lungs, the left lung and the right lung. The blood gets oxygenated and returns through the pulmonary veins. Now it comes back in through the pulmonary veins into the left atrium. It doesn't show it very well on this diagram. It shows it very well on this diagram. You see? Or well enough. From the lungs through the pulmonary veins into the left atrium, fresh red oxygenated blood. From the left atrium into the left ventricle, and it's got to pass through the mitral valve. This is also called the bicuspid valve, mitral or bicuspid. Tricuspid on the right, bicuspid on the left. Bicuspid is also called the mitral valve. Left ventricle is on the bottom, atrium on top, ventricle on the bottom, atrium on top, ventricle on the bottom. The left ventricle receives the blood and pumps it out into the aorta. To get into the aorta, it's got to go through the aortic valve. Left ventricle, aortic valve, aorta. The aortic valve is named after the aorta. From the aorta, one more time, please.
The right is, I have a question.
Yes.
The right is oxygenated, right?
The right side of the heart receives deoxygenated blood.
Okay, I'm just confused because we were saying left is deoxygenated and then right is oxygenated, but then on the diagram,
Oh,
the
that's what I
right is
said.
blue. Oh,
Yeah, that is incorrect. No, that's definitely not correct. No. The right, thank you. The right side is deoxygenated. The
okay.
left side is oxygenated. Please stop me if you are confused, because it means either I'm switching something, or it means you don't understand it.
So that is correct then. The right is deoxygenated and then
The
the left.
right side is deoxygenated, the left side is
Okay.
oxygenated. Can you hear and see how carefully I have to think about it
Yeah,
to be accurate? That's the
yeah,
level of energy you have to put into it. The right
okay,
side is deoxygenated, the left side is oxygenated.
okay. That makes more sense. Thank you.
Yeah, I'm sorry. So left ventricle, oxygenated blood into the aorta, which pumps it to the rest of the body, the upper part and the lower part, and out through the limbs, the aorta. Okay, we see a clearer picture of the aorta here, and you can see that there's branches that go up. There's arteries that come off of the aorta that go up, and there's a branch of the aorta that goes down into the trunk and the lower body, and that descending part of the aorta has arteries that'll come off of it there. Okay. If you go to the presentation, you'll also see this. Oops. You'll also see this graphic of the heart. I'm sorry, the controls are a little challenging for me sometimes. Okay, so you see this graphic of the heart. I hope this is big enough for you. And you see the valves. And I just wanted to show you guys the valves, because you can see, if you look closely, I'm sorry. You can see, if you look closely, the tricuspid valve has like 3 sections in there. It's kind of like a peace symbol, like a circle with 3 lines, a line that branches off into to make 3 lines. So it's 3 sections. The tricuspid, the bicuspid has one line across it, one opening. So there's 2 flaps. There's 3 flaps in the tricuspid, 2 flaps in the bicuspid, aka mitral valve. And you have these sinews or tendons. They're not going to ask you about those. You have these sinews or tendons in the heart that hold the valves to muscles that pull the valves open and relax to allow the valves to close. Okay, you won't be asked about the sinews. So next, the final learning objective or final study point that we're going to do for today is to comprehend what occurs in the various larger structures of the heart, such as I'm sorry, we just did that. We just did what occurs in the larger structures of the heart, such as the valves and the different heart chambers. Now we have to identify the basic categories of the components of blood and the function of these components. This is poorly worded. What does that mean? Categories of the components. So we have to learn the different parts of the blood. All right, there's 5 parts of the blood, and we have to learn the categories of those. All right, so here's the 5 parts of the blood. Those are plasma, red blood cells, platelets, white blood cells, and hemoglobin. Plasma, red blood cells, platelets, white blood cells, and hemoglobin. So plasma is the water. It's the fluid of the blood. It's the main part of the blood. It's 55%. 55% of the blood is plasma. Whole blood contains red cells, white cells, platelets, suspended in blood plasma. Plasma is 55% of volume. This sentence here leaves out hemoglobin. So plasma is the main component of the blood, consists mostly of water. There's stuff in the water. It's not just pure water. There's proteins in there. There's gases, ions, nutrients. There's also waste. Nutrients can be things like sugar. Sugar, unprocessed carbohydrates. They may be proteins or pieces of proteins, amino acids. They may be oxygen. Waste can be things like dead cells, dead red blood cells, broken pieces of structures that are on their way to, you know, the lymphatic system or wherever. They can be destroyed pathogens like dead bacteria or parts of viruses that have been destroyed. They can be other kinds of wastes. They can be gases. So plasma is a plasma is a solution. Plasma is a solution. Water is a solvent. And all these proteins, ions, nutrients, and wastes and stuff in there, those are the solutes. We will look at that again in the future. So red blood cells are also in there. Red blood cells, this is what we think of as the blood. Red blood cells are also called erythrocytes. Erythro means red. White blood cells are leukocytes. Leuko means white. Leukocytes are white blood cells. Erythrocytes are red blood cells. Erythro means red. Cyte means cell. Leuko means white. Cyte means cell. Erythro, red, cyte, cell. Red blood cells, they're the ones that carry oxygen. They also carry carbon dioxide. Did you know that? I didn't know that. Red blood cells carry oxygen and carbon dioxide. That's the function of red blood cells. They definitely want you to know that, or to base your answering of questions on that foundational piece of knowledge. Platelets are also in there. They're responsible for blood clotting. You don't have to know how platelets work. Clotting factors, any of that. Vitamins, you don't have to know any of that. You just have to know that platelets are the ones that do blood clotting. Low platelet count means someone can't clot as well. Low platelet count can result from conditions such as anemia, or it can result from medications like blood thinners. Warfarin or Coumadin, they're called. Blood thinners. We'll be going over those. White blood cells, the fourth part, leukocytes, they're part of the immune system. Obviously, they function in the immune response. Their job is to mitigate or to do immunity, to function immunity. And then there's hemoglobin, which is the protein that contributes the red color to blood, and it carries the oxygen. Hemoglobin carries the oxygen. I believe hemoglobin is built by iron, using iron, and iron is red in color. This is just a graphic showing red blood cells going through a vessel. Remember, vessels can be arteries, veins, arteries, arterioles, capillaries. Does anyone have any questions about plasma, red blood cells, platelets, white blood cells, or hemoglobin? These are the basic components of the blood and the
I have a
functions.
question.
Yes.
For the white blood cells, do we need to know anything about like infection?
Well, you would have to know how the white blood cells function, and I think you do. So broadly, if you look at the slide, I'm circling it. Broadly, what is the function of white blood cells?
For the immune system.
For the immune system, yeah. They function in the immune response. They're part of the immune system. So if there's an infection, what is the job of the white blood cells, broadly speaking?
To fight it off?
To fight it off, or to use the terms like immune system or immune response or function. To what?
Would it be to like let the immune system know?
The white blood cells are part of the immune system. So you could say, using the words response and immune, you could say to begin an immune response, or to get the immune system to respond, or to respond with immunity. Or you could say to fight the infection, as long as you know that that means an immune response.
Okay, I understand now.
Yeah, good. I just wanted to prompt you to start using the actual terms, right? Because that's not part of our active vocabulary. We don't speak that way every day. How much more do we have? Okay. We're out of time. Please read the next two slides on external and internal respiration, and let me know next time if you have any questions. this time for this one, because it's pretty simple, you can let me know in the text message thread if you don't understand external and internal respiration, okay? More slides will be added to this presentation to cover the other study points that are in the that are in the circulatory system. And once we go through enough of these systems and enough of the sections are anatomy, kinesiology, patho, etc. Once we go through enough of these, then we'll start doing some questions from the practice exam websites. All right, guys.
All right. Okay.
All right. So have a great week.
You
And
too.
Thank you.
I will see
Thanks.
you. I'll see you next week, Saturday at 11 o'clock Eastern time.
All right, thank you.
All right.
Okay.